one of the kind of significant side effects of stress is tension headaches, and tension headaches is a result of accumulation of tension in muscles, and muscles can accumulate tension to the degree that will compress greater occipital nerve and will awake severe greater occipital nerve neuralgia. Any neurological pain, neuralgia, pain of nerve, it's always sharp and significant. Now, these techniques that I proposed to you, this was an episode fragment from my DVD number 1, will help to reduce tension in the cervical muscles, upper muscles, and of course not only will cause muscular relaxation, but also will cause vasodilation in turn blood pressure will drop and could be pretty significant, 40 millimeter, and of course ease on cardio work and all these positive changes in functions in organs and systems. But also reduction of tension in cerebral muscles will prevent or will eliminate the compression of nerve or brachial plexus or vertebral artery, that also one of the causes that producing headaches. Now, the other cause of tension headaches is a cranial nerve that could be, when in a point of exits, they could be compressed. 3,000 years ago in the eastern province of Manchuria in China, Chinese doctors, they didn't know the causes. It was prohibited. Science actually was prohibited. Autopsies was prohibited. They didn't know the real causes, as I introduced to you, for tension headaches, but they developed a method that cover plus minus all causes, and this works wonders. I will teach you right now, and you will see even severe headaches actually after one application will be reduced significant or will eliminate it all. But you have to do this repeatedly. All this stress management, this is, as you understood, this is negative package deal, and recovery, when you're reversing conditions, this is also package deal. Therefore, you will have to repeat at least twice a week. You will have to provide yourself with this series of treatment, and probably it will allow you to stay healthy for many years. You just, this is sinuses. By the way, people that have the stagnations in the, within sinuses also will have some relief. You just, like this, slowly, this is like a wings. You see, if you will go from the midpoint to the sides, you see I bend a little bit. You can use thumbs of screws. Thumbs also could be used few fingers, one fingers, few fingers, no matter. You just go, and when you will feel this is kind of like wings of sinuses, yeah, and little by little you have to start compressing. It could be sensitive. You will feel these points pretty biologically active. You play a little bit with kind of angle. You will choose angle of pressure that is most uncomfortable, and you will hold like this to the 15 seconds. You can hold more. Gradually increasing pressure. It's supposed to be like experience of healing pain, no sharp pain. Chinese calling this healing pain. You're like, yeah, it's painful, but you do enjoy it. Next step with thumbs, you eyebrow, the hairline coverage. You're just playing a little bit and you will feel kind of depression. If light you will play, you will feel depression. With you staying with thumbs on this depression, actually acupressure will be applied by gradually flexing thumbs. Yeah, you got the depression. Now you've clipping fold of skin on forehead, and this is kind of to stabilize the conditions. And little by little, thumbs right now compressing against this depression. It could be very painful. Therefore, I recommend very, very gradually, and if you will reach threshold of pain, don't try to overreach. Just stay like this 15 to 30 seconds. This is the axis of cranial nerves, and Chinese actually didn't know this, but they developed a universal approach of this acupressure that works wonders.